Hello my lovelies, I hope you're all doing okay today. I wanted to talk about being heard, knowing your own body, knowing that when you're in pain and something is wrong, that your doctor needs to listen to you. The hospital specialists need to listen to you. I'm also talking a little bit about multiple myeloma. On the 24th of August, I was told I had multiple myeloma and thought, oh good, I've got a diagnosis now, things should track on and everything should be fine. Oh, by the way, this is my beautiful cat Honey asleep on her little blankie on the sofa behind me, bless her. So she's a little rescue cat of mine. I love her to pieces. Anyway, I've seen lots of specialists at the hospital. I've had many GP appointments and I'm told things, I'm promised things, and I think that progress is going to happen, and then you never hear again. You leave it a couple of weeks, you play the waiting game that we all know what that's like, in sort of anxiety, and you hear nothing. So you contact people again and they say, oh well, we're just monitoring you for now, you'll be fine, and that's just the answer you seem to get. Well, having listened to other multiple myeloma patients and sufferers, I have heard from them that it can take many months until they finally get a proper diagnosis and have any view of any sort of treatment plan. Sometimes it's taken even up to 2 years for people. And I said, well, surely in that time while you're just left sort of hanging and they're just monitoring you and you don't hear back from results and you don't hear back from the specialists when they say they're going to, track you on and refer you to other departments for further tests, etc. And then you hear nothing, why does that happen? And well, it's been happening to me because I have said to people, well, surely in that time while you're sort of being left dangling like that, surely your condition must be progressing and getting worse in the meantime. We know that multiple myeloma is a very slow progressing disease. So yes, they can monitor you and look after you. But the disease progressing while they do that is exactly what's happened to me. Today, I went to A&E at 8 a.m. this morning. Dear Lou drove me and sat with me and stayed with me all the time. And it was very good to have my dear friend with me because another pair of ears and another pair of eyes is such a good thing to have, because when you're in a lot of pain like I've been today, and when you see the doctors, you don't take in everything they say and you don't ask questions that you should be asking. And one thing that Lou and I have learned is that you ask those questions. You must give yourself the confidence and the power to ask questions. Otherwise you're never going to get anywhere. You're never going to get any answers to all the anxiety and all the worries that you have in your head. Today we were at A&E at the local hospital for 3.5 hours, but it was well worth both Lou and I sitting there getting very tired, getting very hungry, and sitting there in lots of pain, because I did get some results. 4 weeks ago I saw my neurologist at my local hospital and I told him that I'd got severe arm pain that had been going on for a few weeks, and that it was beginning to travel down my forearm and it was causing numbness in my right hand, and I only had 50% use of my arm. He looked at it, checked my joints and said, it's fine, it's muscular. And then he promised that he'd be talking to my doctor, he'd be referring me on to different departments for further investigations, for further progress with the myeloma, and that he would put me on amitriptyline, a strong nerve pain medication to help me with all the pain I was going through. Well, it's been just over 3 weeks now. There's been no letter to my GP. I haven't heard a thing. So I've sort of just been left hanging. And it got to the point where my arm pain was progressing. It was getting steadily worse and worse and worse, to the point where at least the last week, I'd say week and a half, I haven't even been able to lift my arm or use my hand to pick up a toothbrush, even to brush my teeth. Yesterday I sat with some lunch and I had to use my left hand to feed myself because I could not physically grip or lift the fork to my face. And then the pain was radiating into my chest, behind the right breast, behind the right ribs, and it was travelling into my shoulder and down my back and just causing me immense pain. So went to A&E today, explained to them that my GP had also checked me out 2 weeks ago, and she had reassured me that it was just muscle pain and you'll be fine, and sent me on my way. I thought, good, reassured, but when the pain got to the excruciating, a good 9 out of 1 to 10 scale, what's the worst pain you've had? It was a good 9 this morning, and they were very good at the hospital. I got seen very quickly. They assessed me, they did some tests on my arm, they did an ECG, they did blood tests, they did an x-ray, and they listened. And one tip I'll give to you, when we're on our own, when we see the consultants and see the doctors, we forget to ask questions. I think we feel a little bit intimidated and think, oh well, they're the experts, they know what they're saying, they know what they're doing. But actually I've come to realise that nobody knows the pain extent that you have or the symptoms that you're having apart from you. And unless you can express that to them, you are going to be left, because they're not going to be able to give you the answers that you need. Very valuable lesson learned. If you know your own pain threshold, if you know your symptoms, if you know your own body, like we do, you've got to give yourself the power to ask questions. Otherwise, how are you going to get any progress? Unless you get answers to the questions that you have in your head, you're just going to be left with anxiety, and you're going to be left on that waiting game between results and treatments. So yes, extremely valuable lesson that I have learnt today. Very good that Lou was with me, because she could sit and watch and listen, and any questions that I didn't ask, or anything that the consultant said that didn't sink in with me because I was the one sitting going through all the pain, she picked up on, and she asked questions on my behalf that I hadn't thought of. And it was so good to have somebody else there, to be not just a witness, not just a wonderful support, but someone else to remember what they've said, and someone else to say, oh, hang on, what about this? Which she kindly did for me, and I'm so grateful. So questions were asked. So I had blood tests, I had an x-ray, they did little grip tests on my arm, and asked me questions, and they really listened. I saw a wonderful lady doctor. She sort of went through everything with me. They did an ECG, all sorts of tests were done, and they came back to me so quickly. So within 3.5 hours, I was informed about the blood tests. There were a couple of tests out of range, and they have already sent that to my GP. She said, I suspect it's bone pain, and after the x-ray, and she'd consulted with her team, they could see that there were very large lesions up and down my arm. So basically, I was walking around being told it was muscle problems, but I've got a blooming great bunch of holes in my upper arm, probably due to the myeloma progressing, getting a bit more aggressive. And no wonder I've been in a lot of pain. And she also said that the x-ray, it's not the clearest form of looking at lesions. A scan obviously gives you more detail, but she said they could also tell that in the same shoulder on my right side there were lesions and dark spots and holes. So it explained the reason why my arm was useless, because I was wondering whether I was going to lose the use of my arm. So they have very kindly fast-tracked me. I should hear within 2 weeks for further cancer screening, and hopefully they might decide to do an operation where they put some cement inside the holes to try and steady and fix the bone, or what medication they're going to put me on, whether they're going to do something like radiotherapy that can help heal and stop further bone damage from going on, because each day I'm left, each day there's further bone damage happening. So a painful day, but a successful day. And I would really try and get the point across to any of you that no, there's a problem with your body and you don't think you're being heard. Please realize that you have to give yourself the power. You have to empower yourself to ask questions and get answers and get progress. So even though it's been a long, tiring, painful day, it's been a constructive and progressive day in a good way. So look after yourselves, guys. Know your own bodies and tell your doctors and get the answers to your questions. Thanks ever so much for watching. See you soon.